Good afternoon and welcome to the Lakeland Rotary Club. My name is Nate Dunham and I am your president for 2021-2022. I know some people are still booing, I get it, but you guys keep letting me up here, so I'm going to keep saying it. I'd like to invite Stacy Campbell-Dominic up to do our invocation, Pledge of Allegiance, and reciting of the four-way test.
So this morning, the invocation is going to be a little bit different, and some of you may remember this, but this is my absolute favorite poem, and it will serve as the invocation, so I just need you to listen. Go placidly amid the noise and haste, and remember what peace there may be in silence. As far as possible, without surrender, be on good terms with all persons. Speak your truth quietly and clearly, and listen to others, even the dull and the ignorant. They too have their story. Avoid loud and aggressive persons. They are vexations to the spirit. If you compare yourself with others, you may become vain and bitter, for always there will be greater and lesser persons than yourself. Enjoy your achievements as well as your plans. Keep interested in your own career, however humble. It is a real possession in the changing fortunes of time. Exercise caution in your business affairs, for the world is full of trickery. But let this not blind you to what virtue there is. Many people strive for high ideals, and everywhere life is full of heroism. Be yourself, especially do not feign affection. Neither be cynical about love. For in the face of all aridity and disenchantment, it is as perennial as the grass. Take kindly to the counsel of the years, gracefully surrendering the things of youth. Nurture strength of spirit to shield you in sudden misfortune. But do not distress yourself with dark imaginings. Many fears are born out of fatigue and loneliness. Beyond a wholesome discipline, be gentle with yourself. You are a child of God. You're a child of the universe, no less than the trees and the stars. You have a right to be here. And whether it is clear to you or not, no doubt the universe is unfolding as it should. Thank you. Pledge allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And the four-way test. Of the things we think, say, or do, is it the truth? Is it fair to all concerned? Will it build goodwill and friendships? And will it be beneficial to all concerned?
Thank you, Stacy. And now for our introduction of guests and visiting Rotarians, Andrew Trawler.
Today we have visiting Rotarian Steve Man Ray from the Lake Wells Breakfast Club.
Hi, Steve.
And we have out of town Rotarian Doug McCall.
Hi, Doug.
And that is it.
That's it for today. All right. Happy Dollars, Brendan Hahn.
Okay, who's happy?
I'm extremely happy because Mark and I got our booster shots today.
Ah.
I'm happy with the Lakeville up on the ridge last night. We talked about polio and they committed to raising the minimum of $1,500 for the year, and other clubs are doing that. Thank you. happy I got to play the Omaha Country Club on Friday, and I didn't do as well as Jim Furyk did in the U.S. Senior Open. It ate my lunch. Anyone else?
Any more happy dollars? Well, I've got a few dollars. I am thrilled with how last week went. I'm mostly thrilled that it's over. Man, it was a long week between Know and Grow and the golf tournament and a fishing charter on Saturday. We had a great time. So check out the pictures. There'll be more to come. I do have some that are not so flattering that I'm holding on to. I'll use that to raise money later. All right. Now for a few announcements. If Irma Cole wants to make her way up, and Matt Brown.
All right, our second community outreach project will be held November the 6th. It's a week from Saturday, from 6:30 to 9:30. And we're going to help the Lakeland Runners Club with their 10K race. And we're going to be manning the barricades along Success Avenue. I have 4 volunteers signed up right now. I was told by the club if I can get about 4 or 5 more, that we can actually sponsor a water station for the runners on Success. So if you're interested, please let me know.
So this is your last chance to sign up for the District Rotary Foundation Gala, which is in Lakeland next Wednesday, 6:30 at the Hilton Garden Inn down by the airport. So there's a few spaces left. I urge you to go onto Dactaby. You can register, choose your meal. It's $50 a person. We'd love to see you there. Thanks.
I almost forgot. Dorsey wants to come up and do a solo. So come on up, Dorsey.
I didn't say I wanted to. I was recruited, but I'm happy to do it. Before I forget it, our past president, Bo Jackson, isn't doing so well. And we have a card that Beth, look back in the back, you'll see a card back here. Bo's not going to be able to return to practice. He's not doing well. So we used to do this all the time when someone was ill or home or in the hospital. But anyway, please sign that and keep him in your prayers. I've been communicating a lot with his sister down here, Fairhope, Alabama. Anyway, how many of you are baseball fans? All right, how many are going to cheer for the Houston Astros? Show of hands. How about Atlanta Braves? Well, that solves that. All right. Well, in lieu of that, the first game is tonight in Houston. So let's just keep eating because you don't sing anyway. And the solo is ready to start. Take me out to the ball game. Are you going to sing? You going to sing? Take me out to the ball game. Take me out to the crowd. Buy me some peanuts and Cracker Jacks. I don't care if I never get back, for it's root for the Atlanta Braves. If they don't win, it's a shame, for it's 1, 2, 3 strikes, you're out at the old ball game. Thank you very much. Good.
Book's falling apart. Thank you, Dorsey. Fantastic. Can't wait to do it again. All right. Let's talk about the golf tournament a little bit. For those of you who are there, just raise your hands if you were either there playing or volunteering. It was by far the most successful golf tournament we've ever had. Is Jack here? I didn't see Jack, but I know Trey is here, and I saw Jason, and that whole committee did an outstanding job. So if you see them, thank them. I think, yes. I think we're going to net somewhere right around $28,000 or $29,000, which is significantly more than we raised last year. So thank you to everyone that came out, those that played, those that volunteered, all of the sponsors. We could not have pulled this off without you guys. But most importantly, if you see Jack and anybody on his committee, thank them. They did great. Now let's talk about Know and Grow just for a second and where we are with fundraising. I just kind of gave away the big part. As far as funds raised, I think we are right around $29,000. We don't have that final number yet, but our goal is 55. So we are well on our way. And as far as club participation goes, we're at 34% of club participation. So thank you. There are going to be plenty more opportunities to serve. We have a spring obsession coming up in the spring. And the next Know and Grow is on November 8th, 9th, and 10th. And that's going to be at Philip O'Brien. So please sign up for that. We've got a little more time for you guys to sign up than we did the last couple of weeks. So please check your calendars. And if you can, sign up. We're probably going to need somewhere between 10 and 15 volunteers for that. And if you can make it all 3 nights, that's preferred. But if you can't, we'll just take you one night. It's if you can come out and spend some time with these families and see what they're doing, it'd be well worth your time. I promise that you will get out of it just as much as they do. All right, and now for our program. Stacy?
I'm going to say this. Last week, I said, put me in for 500, and I ran out the door when it was over because I didn't have my checkbook, but I have my credit card.
Oh, well, let me have it. Do some shopping.
Yes. Okay. 500 is the limit, just so you know. So it's my pleasure. Well, before I say this, let me just say, every time I walk in here, and people were in the room over the last quarter, President Nate, we've been getting a lot of compliments. And today was no different. And I just want to share with you compliments about the program and the energy and things of that nature. Let me just share with you that you've got a great program team assembled. Although I'm the one up here giving the invocation every 30 minutes. Just kidding. And introducing the speaker. The team got together and worked to try to present a diverse slate of programs and to plan for the entire year. And we did that. And we just hope that you continue to appreciate what we have to offer, and our speakers continue to show up. But the team consists of myself, Rick Maxey, Gwen Allen, Roxanne Bonta, and Brenda Ramirez. And we had one full meeting over Zoom and planned the entire calendar for the year, not the quarter, for the entire year. And most of the speakers that we've reached out to obliged eagerly. So that said something about this club that people are super excited about. And we're still getting requests from many of you. Also, every time I come in here, we get a new person who says, this person may want to speak. You may want to consider. So I don't think we'll have to cancel a program, cancel a week because there's no speaker. And I don't think we'll have to have repeats because we've got people on the list who are interested. So thank you all. Thank the committee. I will introduce our speaker just for the health of it. I said health.
It's catching on.
It's catching on. That's a bad mom joke. Dr. Joy Jackson has been the director of the Department of Health in Polk County and the Department of Health in Hardee County since September 2015. Prior to this role, Dr. Jackson practiced general internal medicine in a large multi-specialty clinic in Polk County from 1988 to 1998. She joined the Lakeland Regional Medical Center as physician liaison for documentation and coding and was involved in case management and quality improvement. In 2011, she joined the Department of Health in Polk County as a senior physician, becoming medical director in 2012. Dr. Jackson received her Bachelor of Science degree from the University of South Carolina at Aiken in 1981. In 1985, she earned her Doctor of Medicine from the University of South Carolina School of Medicine. She completed a residency in internal medicine at the University of Florida Shands Teaching Hospital in 1988. She's married to Mike Martin, an attorney whose family has resided in Central Florida for 5 generations. They have 2 children, Catherine and Rachel, and she enjoys spending time at the beach, traveling, and reading. I hope you get the reading done. I can't imagine you've been at the beach all day. So thank you so much for coming.
Good afternoon. Thank you all for having me here today. And I see a lot of faces that I know and I recognize in my 31 years in Polk County. And I literally live about 5 blocks from here. So I had the pleasure of working at home this morning and enjoying the beautiful day outside. So I just want to take a second and pause and be thankful that COVID numbers are improving, that the weather is beautiful, that we're facing holidays. And I think that the invocation that Stacy gave us was extremely appropriate and really calmed my soul. And that basically those thoughts are my mantra in life right now through our tumultuous past couple of years. So I want to take a few minutes and talk to you all about a non-COVID topic to begin with, and that is how healthy are people in Polk County. And what can we do as individuals pertaining to our own health and as civic and community leaders where we are influencers for our families and the places that we work, our civic groups and our churches, so that we all can be encouraged to be healthier next year than we were this past year. And then we'll also give a brief COVID update and try to answer some questions on things that are changing very rapidly. In fact, you'll laugh at one of my slides about boosters because it's changed since I created that presentation. Let's see if I can figure out how to work this. It says on. Okay, now let me go up. Did I do it?
Don't ask me how to do it.
Okay. I've got a smart person that understands.
Let's see. So we're on.
Takes a mayor.
Yeah, well.
All right, Mr. Mayor. No
Sorry.
pressure here.
We're working on this while you do that. Keep going.
Okay, all right. So I will start off with some demographics for Polk County.
You got it.
Yay. All right, thank you, sir. I appreciate it. How did you do that so I can go to the next slide and you won't have to get out?
So you want to just go like this?
I may have to go backwards if you go too far. I'll just call you up.
I'll do this.
Thank you, sir. All right, next slide, please. All right, so Polk County population is reported for 2020 to be over 725,000. And this is a 20% increase in the past 10 years. Lakeland's population is now up over 115,000, which is a 15% increase in the past 10 years. Who can tell by the traffic on the roads and the crowdedness of our restaurants? So the data is proving it out. Our median age is 40.2, which means half the population is older and half the population is younger. Our racial spread is about the same that it's been, but our ethnicity-wise, Hispanics have increased by over 17% since 2010, with 26.5% being Hispanic, and we are slightly predominantly female. Next slide, please. Median household income is $50,500, which is less than the state. 86.5% of our population has completed high school or higher, compared to the state of 90%. 20.2% have a bachelor's degree or higher, compared to 29.9% for the state. And life expectancy on the average is 78 years. There is a disparity between males and females. Females tend to live about 5 years longer than males. Caucasians live a little longer than Black, and Hispanics are our longest living group at 81.3 years. So a little bit about our numbers. Next slide, please, sir. Okay. Okay. The one with the blue bars, if you can get to it. All right, so this is a snapshot of our population by age range. So these are 10-year age ranges, and you probably can't see the numbers, but on the left are kids that are 0 to 9 years, 11%, and again in 10-year increments. When we get up to 80 plus, only 5% of our population, which is as expected. Next slide, please, sir. Oh, I'm sorry. Okay, deaths. Thank you. In 2019, there were 7,379 deaths recorded in Polk County. 2020, and these deaths are still viewed as provisional, we were 8,590. This year, and realize that this data is only 9.5 months worth, 7,875. I want you to realize that in the past 2 years, we've had 2,381 COVID deaths. And I will tell you all, between the months of August and September, Polk County had over 800 deaths related to COVID. 800, over 800 in 2 months. Our death numbers are starting to come down, thank the Lord. Leading cause of death in Polk County, number one is heart disease. We have about 1,700, 1,800 deaths a year from heart disease. Cancer is number two. If you're interested, cancer incidence numbers are staying about the same over time, but deaths are decreasing from cancer because there's less cigarette smoking and people are getting preventive testing and treatments have improved. For women, the number one type of cancer that's diagnosed is breast cancer. Number two is lung cancer. But when it comes to deaths for women, they're reversed. More women will die of lung cancer, and the second leading cause of death for cancer is breast cancer. Colorectal is number three for incidence and death. For men, the number one cancer diagnosed, beyond the typical little skin tissels, which my husband supports, all the dermatologist in town, is prostate cancer is number one in incidence, but deaths for men is likewise lung cancer. So again, reversed. Number one deaths for men is lung, number two is prostate, and then number three, like women, is colorectal. Strokes are more common in African Americans. I want to talk a little bit about disparities. We do have disparities in our community where some conditions are more common in African Americans or Hispanics. Strokes, unfortunately, are more common in African American. Unintentional injuries are the fifth leading cause of death in our county. And these are things like in children, it's unfortunately things like suffocation related to co-sleeping. So we have a big push in our under 1-year-olds. Our greatest risk of death is in SIDS, sudden infant death syndrome, which is generally attributed to suffocation and co-sleeping. So we talk a lot about the ABCs of safe sleep for infants. Infants should be alone, on their back, in a crib. No blankets, no stuffed animals, no bumpers. And you all, many of you are parents, many are grandparents. The data has shown this is effective to reduce sudden infant death. I cannot tell you how many parents co-slept with their child and were devastated when their child died, likely related to suffocation. So please, we all want to be close to our grandkids and our kids, but the safest place for them is in their crib. The other traumatic injury in our young children, which is toddlers, is drowning. Polk County, I believe, is number 2 in the state of counties for drowning deaths, which generally is in our younger kids, our toddlers, and our young children. So safe swimming, swimming pools, lakes, buckets of water are all areas of risk for young children who are intrinsically very curious. On the other spectrum, unintentional injuries in our older age group tends to be related to falls. This has happened to my family. People will fall, they will break a hip, and then they have, unfortunately, then demise after a fractured hip related to complications. Diabetes, our incidence of diabetes in Polk County is higher than the state, and again, is higher at African Americans. So one model to look at how do you put the data and the story together. You all may be aware of Robert Wood Johnson County Health Rankings Population Health Model. This is an amazing website where they literally have taken every county in the nation and put it through the same data analysis to look at health outcomes, which are determined or labeled as quality of life and length of life. So how long do we live and what's the quality of life? And a lot of the quality of life measures are done by survey of individuals because quality of life can mean different things to different people. But factors that impact how long we live and how well we live are things like our health behaviors. That's our tobacco use or diet and exercise, alcohol and drug use, clinical care, access to health care and quality health care, social and economic factors. These are the social determinants of health. These are where you live, work, and play, go to church, and your family connections, and then the physical environment. If you will look briefly at the numbers in the parentheses, those are the impact as determined by Robert Wood Johnson on the quality of life and length of life. And you'll see of all of those factors, selfishly as a physician, I thought access to physicians and quality care would be number one. Nope. It's our social and economic factors have the biggest impact on how well we live and how long we live. So it's your neighbors, it's your families, it's having economic stability, having a job, having a meaning. Those have more impact on how long we live. So how does Polk County do in the rankings of Florida? We are ranked 29 out of 67. Better is lower. St. Johns County, which is more affluent, generally holds the #1 mark. Polk has improved over the past few years. So we're a little bit better than average. But the areas of concern for Polk County, we do have, and there's a metric called years of potential life lost. So Black length of life is lower than state average. 22% of adults responded being in poor or fair health compared to Florida at 20%. So you can look down the list. The smoking is higher than state. In adults being obese is higher than state. Adults being physically inactive is higher than the state. Our numbers of providers for primary care, dental, and mental health, and our children living in poverty and children in single-family households. These are areas that we could serve to improve. Next slide. Where do we do better compared to the state? Believe it or not, less than excessive drinking. Mammography screening is better than the state, except in Hispanic population, which we're working on. Violent crime, air pollution, and severe housing are better than the state. But severe housing of 17% still is not good. And I appreciate what the city of Lakeland is doing to try to establish more fair housing. The other way we look at how healthy our community is a community health assessment. This is an assessment that's done every 3 to 5 years. And this was last completed and reported in early 2020. This was a collaborative effect of Polk Vision, the health department, and a Polk County Community Health Assessment Work Group. This is not taken lightly. This was a very robust assessment that involved community surveys where we made sure the demographics matched the demographics of the community, focus group discussions, key informant interviews, and secondary data review. There's a ton of data out there, but you got to put it in perspective of what do people also look and feel and think about. Next slide. So I will brag on our community health assessment for Polk County. It's almost 300 pages. It's available online. It's beautiful. There's a lot of information in there that gloms these 4 assessments together. So what's the Reader's Digest condensed version of what was found? Next slide. These are the top community health needs, again, based on interviews, surveys, and the data. These are the buckets where there's opportunity for improvement. Doesn't really do any good to analyze if there's not actions to create improvement. Our community groups cannot tackle all 10 of these. So the next slides are where the work group decided to focus energy. So these are the 2020 Polk County priorities that will take us for the next 5 years. The number one concern from the data and community leaders and the public are behavioral health needs. This is both mental health and substance abuse, access to health care, and exercise, nutrition, and weight. 2 cycles ago, the access to health care rose up, and that has stayed on our CHIP list. And last time, exercise, nutrition, and weight was our number one problem, and that stayed on the list. So those activities are still occurring. So what came out of this is the Polk Behavioral Health Team, which is a collaborative project that went through a year-long evaluation strategic planning facilitated by a consultant from out of state called Crescendo. And the goal from this group is to improve the quality of life by addressing behavioral health needs, and is in the process of a tactical plan being established. Next slide. And these are the 5 core strategies that were determined to be needed for Polk County. Again, we can't fix things unless we can measure them and unless we have people assigned to tasks. We want to expand crisis services. We want to create a Polk County Behavioral Health Coalition, which has already been established. We want to expand the capacity of behavioral health services in Polk. We want to expand criminal justice services to reduce recidivism and to address the needs of inmates when they come out of jails and prisons to prevent them from going back. And we want to engage diverse communities to improve our community health and behavioral health. Next slide. Indicators that we'll be monitoring: hospitalizations, self-inflicted injuries, suicide, adverse childhood experiences, Baker Acts, and substance abuse. How many of you in here have heard of adverse childhood experiences? Anybody? Okay. This is a relatively new concept that came out of a research study in California. This is the study that shows things that happen to us in our early childhood impacts not only our mental health, but our physical health throughout life. People that have 4 or more adverse childhood instances have a shorter life expectancy and are more likely to die of things like heart disease and cancer. When we conducted our community assessment for the child, 40% of our respondents had 4 or more adverse childhood experiences. And this was across the spectrum: rich, poor, ethnicity, race, it didn't matter. So this is a big focus. We need to protect our young children and support the families of those young children. Next slide. Okay. Any questions about community health assessment? It's a big chew. Yes, sir.
What is childhood adverse experience?
Yes. The question was, what are things that would categorize as an adverse childhood experience? It could be abuse, neglect, living in a home that is physically not good. They may not have electricity part of the time. The parent could have been incarcerated. It could have been sexual abuse. I wish I could remember all of them, but there's a set list, and that was part of our question. But again, 40% of our people had 4 or more, which is huge. Any other questions about? Yes, ma'am.
The last topic about child health, what the school system in any way to monitor this?
Yes, absolutely. The school systems have employed many more social workers, and there's great collaboration between the schools, school health, the school district, to recognize, and reduce things like Baker Acts. But this starts not only before the schools, it starts with Healthy Start. It starts with the WIC program. It starts with the healthcare providers, our early childhood providers. What are the resources to help support families to help prevent these traumas? And then once kids do start school, what is the safety net for families and children? A single child is never in crisis, it's their family. And what services are there to help sort of break these trends that are occurring? Any other questions about community health? Okay, so let's talk a little bit about COVID. Who's tired of COVID other than me? So let's look at community metrics. And I know you can't see the numbers, but these are our weekly cases since March of 2020. Our first peak occurred after July 4th of last year. Second peak was just around the holidays of Christmas, New Year's. The next peak was a bump up around March and April. And then we were living sweet. We thought we had COVID in our rearview mirror in May and June, and then Delta variant hit. And that was that huge peak. And this is classic for Delta variant. It was a steep incline and a steep decline. But we had maximal cases of around 7,800 cases that were diagnosed in the second week of August of this year. Now, are these all the cases that there were? No, there were more. These are only the ones that we knew about. A lot of people were either asymptomatic, minimally symptomatic, didn't get tested, or more recently did a home test and never got reported. But at least this shows what we've been through, and it's been hell. And we're fortunately coming out of it. This slide shows Polk hospitalizations, which is the solid line, which pretty much mirrors our cases, and the bars are the deaths. And you'll see that deaths usually lag behind hospitalizations by 2 to 4 weeks. And I already told you guys that we had a heck of a lot of deaths in August and September. So let's talk a little about vaccinations. Currently, over 400,000 Polk residents have received at least one dose of vaccine, which means 66% of our eligible population, age 12 and older, have received at least one dose, which is 56% of the total population. And I'm also going to brag on my team. And I heard from my director of nursing this morning, the health department has provided almost 160,000 doses of vaccine. There have been numerous community partners from pharmacies, healthcare providers, and the health department that have vaccinated. There are currently over 150 locations in Polk County to get a vaccine. So it's not all in the backs of the health department. 6-7 months ago, we were the broker of vaccines and gave them to community partners like Lakeland Regional, like Winter Haven Hospital, like Watson Clinic, to help them help us vaccinate, because I didn't have enough staff to do it. But in spite of that, my team still does fixed site, mobile, and outreach vaccination. Again, we've reached almost 160,000 doses just with the health department, which consists of about 20 nurses. So I thank my nurses every single day. Vaccination by age group, our 12 to 19-year-olds are about 45% vaccinated, and it gets progressively more. Our over 65s, I could kiss and hug every one of them. 87% are vaccinated. Next slide. So by race and ethnicity, I'm going to start with a disclaimer. Probably 20 to 25% of people that got vaccinated didn't give us a race or ethnicity. So this data is not really accurate. We tried, but we cannot force anybody. Everybody we vaccinate, you ask race and ethnicity, you cannot make an assumption, but some people simply don't want to give it, and I fully understand that. But is there a disparity amongst African American and Hispanic being less likely to be vaccinated? Possibly. And we're really trying to get past that by doing many outreaches, and I've done presentations at churches, because we need the influencers of the communities to help get vaccination out. We've also done a bunch of vaccination in our agricultural worker populations, trying to get to those that may not have the means to be able to get to a vaccination site. Next slide. So third doses and boosters. Third doses have been available for severely immunocompromised 28 days after their second mRNA vaccine. That's been available now for about 6 weeks, but the boosters are the big hit. And again, I made these slides in the last week before the CDC came out with their statement. Now boosters are available for all of our vaccination types. If you're 65 plus, for J&J, Pfizer, or Moderna, you're eligible. If you're over 18 and have underlying health conditions, you can get one of these, and you can now mix and match. So the tendency is to get a third dose or a booster of your original series. but I encourage people to read and look and see what suits you. You can switch over from an adenovirus vaccine, which is Johnson & Johnson, and get an mRNA vaccine. I cannot tell you that there's one method that's superior, and I will not discount natural infection. My mom at 86, unfortunately, had COVID in January before I could get her vaccinated. Fortunately, she did well. But there is some thought that natural infection on top of vaccination may be superior, but we just don't know yet. But I hear a lot of people say, oh, I had it, I don't need to get a vaccine. You need both. And we are starting to see some breakthrough cases, so we just don't know yet. There's no smoke and mirrors and subterfuge that data is being hidden. That's not true. Every day is an education on how effective and long-term vaccinations are, as well as natural immunity. We know a whole lot more now than we did a year ago, and we're going to know more next month than we know this month. So please just read, be aware of your own risk factors. Vaccination is by far the most important thing you can do to prevent coronavirus, whether it's your primary series or whether you're getting a booster. Monoclonal antibody is still available in Polk County. Both of our large hospitals are offering it, and we still have the monoclonal site at the Lakes Church on Memorial Boulevard. People can self-refer to the Lakes Church. You can sign up yourself if you tested positive or if you're at risk and exposed. So that's still available, and there is an antiviral that's going before the FDA for approval, molnupiravir, which will be an oral antiviral that's not been approved yet. So the armamentarium for treatment, I think, is going to be expanding, but still at this point, vaccination is clearly the best thing we can do. It reduces the risk of serious disease, hospitalization, and death by over 90%. So I strongly encourage that. Yes, sir.
We get our antibody test so we know where we actually are, either from natural immunity or post-vaccination.
So the question was, does getting an antibody level really inform you? And unfortunately, at this time, the answer is we don't know what to make of those antibody levels. So I don't at this time really recommend, does it give you assuredness if you've got a positive antibody that you're protected? We don't know for sure, because there's different types of antibodies and we don't know what level of antibody is protective. So the CDC website does not promote getting an antibody level to prevent you from needing to get either a vaccine or a booster. We just don't know. You know, in a year, we may have a level, or the type of antibody, we may know more. In variants, I'm sure there'll be questions about variants. We are where we are because of Delta variant. There's a new, something called Delta Plus, which apparently is going through United Kingdom. I watch what goes on in other countries, United Kingdom. A lot of times these things end up coming to us. We just don't know yet what Delta Plus is going to do to us. Do I think there's going to be another uptick in cases? Likely, hopefully nothing near like what we had in August and September. But as we are out and about more, less likely to wear masks. As we get together for the holidays, I do have concerns. That's why I still wear my mask, because of the vulnerable people in my household. Questions? Yes, ma'am.
Delta, and with that, you also get Delta Plus. Are we distinctly enough, or?
We don't know yet. We just don't know yet. Wish I could answer that. Yes, sir.
I'm curious about the PCR cycle used to test. It's my understanding that the higher PCR cycle generate false positive in practice every single case, if you go high enough with the PCR cycle. I had tests last year. They wouldn't tell me the PCR cycles, in spite of Governor DeSantis saying everyone must reveal PCR cycle. So do we have any information on that? My other question is, with respect to the Delta variant, it's my understanding that there is no revealing of the Delta variant with tested population at large. So in other words, you don't get a sheet of paper that says you're positive and it is the Delta variant and we're sure about that. So since we don't know that, how do we know that the second uptick was in fact the Delta variant?
And I can't answer that one more than the first one, because the PCR cycle, I'm not privy to that data. And again, I can't correlate the risk of false positivity. I just don't know that. So I can't answer it with any intelligence. As far as knowing that we're Delta, what happens is there is surveillance testing of a random sample of tests that go to state laboratories. And the CDC analyzes the data. And basically right now, over 99% of cases that have been tested have been proven to be Delta. We have been able to request Delta testing when there's a big outbreak, but it doesn't really inform us that we do things any differently. But you can look at the CDC website. There's a data tracker for COVID, and it will break down by region, and it may go to state level. It doesn't go to county level, but right now over 99% of COVID in the country is Delta variant. So again, it's done by random sampling because there's no way to test every sample.
Okay, thank you.
Yes, sir. Other questions? All right. My staff would kill me if I did not put a plea out to everyone to get a flu vaccine. We had virtually no flu season last year because we all had masks and we were staying home. There was concern this year that what we don't want is flu and COVID at the same time, because the symptoms early on can look very similar. So please mind your P's and Q's when it comes to getting a flu vaccine, and get your boosters when you're able to. If you are at risk, still be mindful of your activities. We have to learn to live with COVID. We have to adapt to it. It's not going to adapt to us because it's going to keep trying to infect us. That's what nature does. We're not smarter than COVID, but we can outsmart it with activities that we do, and just be mindful of your health and the risks that you've got for yourself. And I am available 24/7. If anybody has questions, I offer that to anybody, because I am your health officer and I'm here to help support the health of the community. And I thank you for what you all are doing.
Thank you for that very timely update, and I certainly hope that we are in the rearview window. Please accept this as a token of our appreciation. And Stacy, you've got some packages being delivered on Thursday. If you can just bring them next Tuesday, they're mine. Okay, Stephanie, did she make it? Okay, she wanted to give a quick announcement.
I could probably just say it from here. I don't really. Can y'all hear me?
Well, the people on Zoom. People on Zoom.
Our Zoom friends. I'm sorry. Totally forgot about that. It still exists. Zoom still exists. Okay, sorry, Zoom friends. Tomorrow night, trivia night at the Heights. Please be there at 5:30. Our very own Jack Woman is going to host trivia night. November 16th, we're going to have a social at Yard on Mass, and December 10th, we're going to have coffee talk with Nate. Thanks to everybody who came out for our fishing trip. Rick, thanks for your help for setting it up. We had a really good time. If you haven't seen the pictures, which I'm sure Nate will share them with us soon, we all kind of fell asleep. So we were pretty pooped. It was great. So, and we all took pictures of each other sleeping. So wait till you guys see those. It was so fun. So.
Thank you, Stephanie. Okay, next week's program is Richard Wilder, President of Buffalo Soldiers. And I'd like to thank our visiting Rotarians, Steve Manry and Doug McCall. And this week's joke, Halloween joke.
All right.
I know, you ready? All right. Why did the Headless Horseman get a job? He was trying to get ahead in life. Thank you. We are adjourned.